Hey guys, welcome to Bell Reaction, wherein we discuss about the drug and its adverse reactions. In this lecture, let's learn about heparin and its adverse reactions. Let's begin with the sneak peek of heparin, which belongs to the class anticoagulants or simply blood thinners, which are indicated to venous thrombosis, pulmonary embolism, acute coronary syndromes. The popular brand names around are Caprin, Beprin, and even Blockazol. Now, coming to its mechanism of action, heparin activates antithrombin 3, which binds to heparin sulfate surface receptors, which cuts down the active clotting factors such as 10A and 2A, thus hindering the coagulation cascade from further proceeding. Coming to the structure of heparin is made up of heteropolysaccharide that cuts down the activated factor 2A and pentasaccharide that actively cuts down the activated factor 10A. Such type of heparin is called as unfractionated heparin or simply UFH, which was slightly reduced to lower molecular weight heparin by reducing the length of polysaccharide so that it efficiently cuts down 10A but lesser efficient in cutting down activated factor 2A. Some examples are enoxaparin, tinzaparin, which was furthermore reduced to active pentasaccharide, which has only 10A hindering activity. Example is fondaparinux, which is evident for its lack of thrombocytopenia causing tendency. Now, coming to its major adverse effects such as thrombocytopenia, osteoporosis, hyperkalemia, hemorrhage, and alopecia. Firstly, heparin induced thrombocytopenia or simply HIT. So, the story begins with the platelets. Platelets, when activated, they secrete special proteins. They are secreted from dense and alpha granules. Now, coming to alpha granules, which secretes proteins known as platelet factor 4 or PF4, that forms a tetramer which binds and neutralizes proteoglycan molecule such as endogenous heparin sulfate. This PF4 also recognizes and binds to heparin. Heparin has a strong negative charge density containing heteropolysaccharides. Thus, the positively charged PF4 binds the negatively charged heparin and neutralizes it, forming heparin PF4 complex on the platelet surface. These ultra-large complexes form mostly efficiently with unfractionated heparin and 10 times less efficiently with low molecular weight heparin and least or no complex with fondaparinux. This phenomena accounts for the greater incidence of HIT in patients receiving unfractionated heparin compared with the other types of heparin. Generally, 2% of the population recognize these heparin PF4 complex as foreign and form anti-heparin PF4 antibodies. These heparin dependent antibodies usually develop between 1 to 2 weeks after heparin exposure when administered for the first time, while HIT is developed at the first time of administration if the patient is previously exposed to it. These autoantibodies bind to the PF4 on the platelet surface, forming anti-heparin PF4 antibody complexes. Note that the fragment crystallizable or simply FC region of the antibody is a tail part of the antibody that interacts with the cell surface receptors present on the platelets. Platelets have the FC receptors that recognize and capture the FC region of the bound antibody. The neighboring platelets also recognize and bind to the FC region and becomes activated. Once activated, they secrete their alpha and dense granules and hence additional PF4 is released from them. That creates more antigenic substrate for the HIT antibodies. The IgG coated platelets are removed from the circulation by macrophages, and the remaining platelets gets consumed in the formation of microthrombi. Both platelet clearance and the microthrombi formation leads to the clinical findings of thrombocytopenia, that is reduced platelet count. The anti-heparin PF4 antibodies also find their way to the endothelium, where they bind to heparin sulfate on the endothelial surfaces and cause endothelial cell activation or simply an injury. This leads to increased tissue factor expression and thrombin generation. The antithrombin PF4 antibodies are also recognized by Fc receptors on the monocytes, gets activated. The end result of endothelial and monocyte activation results in thrombosis, usually seen in veins compared to arteries. So, who is under the risk? Majorly females and the patients undergoing surgical procedures and even the cancer patients. So, what's the solution for such a grave problem? That is, the primary drug of choice is lipirudin, argatroban, and fondaparinux. Now, coming to second adverse effect of heparin, that is osteoporosis, that is caused by increased bone resorption by stimulating osteoclast and suppressing osteoblast activity, leading to decreased bone mass and also enhances parathyroid hormone function, which is a key regulator of calcium in the body. Parathyroid hormone, when stimulated, causes release of calcium and phosphorus from the bone into circulation, thus reducing the overall bone mass. So, thirdly, coming to hyperkalemia. Hyperkalemia is a condition of abnormal high levels of potassium, that is, greater than 6 millimoles per liter in the circulation. So, heparin induced hyperenemic hypoaldosteronism, that is simply due to the atrophy of zona glomerulosa of adrenal glands, which is responsible for the secretion of aldosterone. Also, with that, the combined effect of heparin inhibition of final enzymatic step in aldosterone formation, that is at 18 hydroxylation. Now, due to toxic effects of heparin causes hypoaldosteronism combined with increased levels of renin in the circulation. Heparin also decreases number and affinity of angiotensin II receptors in the adrenal zona glomerulosa, reducing the main stimulus for aldosterone synthesis. Thus, as a result of combined mechanisms, causing lack of aldosterone results in reduced renal potassium excretion with reduced sodium resorption, especially at collecting duct of nephrons. Finally, heparin induced bleeding. As the body's ability to make blood clots is being reduced, thus results in heparin induced bleeding. Thank you for watching. If you think this video helped you gain knowledge, then please consider it sharing. Let's learn together. For more such pill reaction videos, subscribe to our channel and stay tuned for more.